Good morning, everyone. This is Dr. Dan Lieberman. I'm the medical director of Phoenix Spine and Joint. Did you see the video of Joe Burrow's knee dislocation on Sunday? The Heisman Trophy winner and last year's #1 NFL draft pick experienced just a gruesome tackle. And the way things go today, it was all caught on national TV. Check out this video. This is Joe Burrow here. You can see his leg is fully extended. And watch right there. This is his knee. You can see it completely dislocate and then retract back into the normal socket. It's just a horrible thing to watch. And, quite frankly, you know that in your gut. And the reason why you know that is it's not normal. The knee has a series of ligaments internally which stabilize it. And the main one that prevents the leg bone from moving forward on the thigh bone, the way Joe's did, is this guy right here, the anterior cruciate ligament. It's a really strong ligament. It's hard to tell from this picture, but it's actually kind of shaped like a ribbon. And there are others that hold it together, but in biomechanical studies, 85% of the strength of your knee comes from that anterior cruciate ligament. So you really, really need it, especially an elite athlete like Joe Burrow. Well, what happens next? For Burrow, it's definitely an MRI, and it kind of raises the issue. A lot of people play sports on the weekends. A lot of people may be doing something and they have knee pain. An elite athlete, where there's hundreds of millions of dollars at stake, definitely needs an MRI. But do you? If you have knee pain, do you need an MRI? Well, definitely if you can't walk, if you've got a history of a cancer that could possibly go to bone, very, very rare, but of course, then you do. And certainly if you're having any kind of symptoms that could be consistent with infection, like fevers or shakes or chills, then the concern is there could be an infection going on and it just sort of showed up as knee pain. Very rare, but obviously if that happens, you need immediate medical evaluation. But if you can't walk, you never had cancer, and you're not having fever, shakes, or chills, then probably best to give it a couple few weeks. Within 3 weeks, most of these kind of injuries are going to resolve by themselves with some anti-inflammatory, that's, Aleve or ibuprofen, and probably some Pepcid or Prilosec to help protect your stomach. But let's say you get there, you get 3 weeks out and you're still having pretty severe pain. What's the next step? Well, at that point, you really need evaluation by a doctor, and that could be your medical doctor who's going to order blood work, make sure there's none of that underlying infection. Or these days, even a chiropractic doctor. There's a lot of really good primary care chiropractors in the community, and they, like the medical doctor, will examine you and then get an x ray. On the examination, they're going to do just what they did to Joe Burrow right there in the field. And if you saw the video, you saw, I don't know if that guy was the orthopedic surgeon or the trainer, but somebody held his kneecap with their one hand and then moved the knee back and forth with the other. That's called Lachman's test. And it's actually a really accurate way to determine on examination if that anterior cruciate ligament is intact or not. Presumably, it looked like it was not, and the team shortly released probable ACL tear. That doesn't mean there aren't other injuries as well. There could be other ligaments injured. We'll know that after Joe's MRI, but at least it's very highly likely that he's got the ACL tear. Well, what about you, the weekend warrior? There's three causes of most knee pain, and those are ligament injuries, and the ACL is the most common. There's also arthritis. Arthritis is extremely common and is the leading cause of knee pain for everybody. The arthritis shows up really well on an X-ray. So when your doctor gets the X-ray, he'll be able to rule that in or rule it out. And then the third thing are meniscal injuries. And meniscal injuries are another thing that shows up on MRI, but not on X-ray. So let's say your blood work is normal, your exam suggests something going on, and then your X-ray shows no arthritis. well, then you do need an MRI. And what to expect if you're having an MRI of the knee is a really, really cool, it's a really, really cool chance to image your knee. Let me show you. This is kind of a clip that shows what an MRI shows. You get several views of the knee. You can see the ligaments really clearly. You can also see the meniscus really clearly. So you're going to know, your doctor's going to know after that MRI what's going on with you and what to expect next. Well, just for the sake of argument, let's say that the MRI does show that you have a ACL injury. What's next for you? Well, we know what's next for Joe Burrow. That's surgery, and the reason is surgery is the only way to get you back to normal, to get you back to good activities. If you're really elderly or you're really young, surgery may not be the right answer. But for all intents and purposes, if you have a complete ACL tear, let's assume that you need surgery. And let's talk about what that would be like. You know, the surgery is known as ACL repair, but that's not actually what they do. Really, what they do is ACL reconstruction. This is an example. So here's the patellar tendon, the tendon for the kneecap. They've taken it out as a graft. Here's the torn ACL. And through an arthroscope, the surgeon is going to place that tendon graft from the thigh bone to the leg bone. Here's the graft going in. And then he's going to anchor it into position on the thigh bone as well as the leg bone. And that combination of activities is going to anchor it there and fix it. As your bone heals, as the graft is fixated in position over a period of 2 to 6 months, it's actually going to be every bit as good as new. Joe Burrow will likely undergo this surgery in the next few days. It's you can expect a long recovery, 2 to 6 months. During that time, there'll be plenty of therapy and a whole ton of strengthening. But at the end of it, like other professional athletes before him, he should be able to return to normal activity. He should be able to return to his profession. And what that do as a everyday average person like you or me means you can get back to everything. Once you've recovered, you've made a full recovery. The surgery is done in an ambulatory surgery center, so you don't have to face a COVID infected hospital and hospital errors and staph infections and all that stuff. The surgery takes 1 to 2 hours. You walk out of there and you're back to work within a week or so. So really bad thing to have happen to you, but long term, the recovery, you can put it behind you so that 6 months to a year later, it's in the rearview mirror. And hopefully we'll all be seeing Joe Burrow out there playing football, and our injuries will recover just as well. If you have any questions about this, don't hesitate to get a hold of us at Phoenix Spine and Joint. We're experts in knee surgery and the treatment of knee injuries, and hope it's not your problem, but if it is, just let us know. Thanks for your time and have a great day.